to change me. And, I'm, and for me, th- that is a corridor that I have actually wheeled myself through. And I took that with so much pride and honor to to announce that I am a warrior for for spina bifida. I'm ve- I'm very proud of to call myself a spina bifida warrior because I've turned my purpose into something for other children. As a motivational speaker, I take what I've learned and turn it into something that reaches people outside these walls. I tell them God doesn't waste pain, but the door you didn't choose can still lead somewhere that that matters. My pain became proof I could survive. My routine taught me discipline. My wheelchair gave me a view of people that most never see. I don't ask you to be grateful for suffering. I ask you to refuse to waste it. And as a RX radio presenter for the kids at Red Cross Children's Hospital, I get to speak to a version of myself that was 8 years old and scared in a hospital bed. On air, you don't see the wheelchair, you don't see the shunt, you just hear a voice that says, I know what this feels like, and and you're not alone. We laugh, we talk about cartoons, football, silly stories for 30 minutes. The word isn't a word, it's just kids being kids. That's the power of radio. It reminds you that you're more than your diagnosis. See, purpose didn't come to me when I got better. It came in such a way that I realized my story while they still in it. If if God decided to put in an opportunity in front of you, take it with open hands and take a step through. Even though your hands are shaking, your 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 mind is overwhelmed with multiple things. Uh, take that step and walk through it. For me, that opportunity was to take 16 years of hospitals and turn it into a microphone. One microphone for the stage and one for the airwaves. So, to every kid listening in a hospital bed right now, you're not just a patient, you're not just a case file. You've got a voice, and your story isn't finished yet. Whatever door is in front of you, walk through it. You might find that one day that the thing you thought would end you was the thing that woke you up. And I'm very grateful for actually having this opportunity to to actually turn these things into such a way that actually turned my whole life around and to actually hear the many things that parents and children have been going through, which is part of my motivational experiences to my RX radio, which is all linked into one thing. And my purpose was to bring out children with disability. And for me, of being a patient at RX, of me being a patient at Red Cross Hospital, I've been part of RX Radio for the past 2 years. Being a reporter for RX Radio is a space for me and for many other more to express themselves and to express the amount of the to express the impact of many lives. All the years, I've received excellent service and treatments from RX Radio. Doctors are always welcome to me and ask my option as well. I'm free to ask many much more questions concerning my health. I only had one bad experience recently after my operation on my femur, which I felt that I was discharged very soon due to me being a spinal bifida patient, which led to me having no sensation, absolutely nothing into my legs. I feel that doctors must consider patients who have no sensation in their legs to keep them in a hospital up until full recovery, to monitor the wounds after our operation, especially when one has an infection in the body. And I'd like to say thank you very much for listening to my story. I'll be handing it over again to Donna.
Wow, thank you so much, Salamuddin, for that really real and true account of what your experience has been over the last couple of years. I think it's very humbling to listen to how you've been able to rise above your challenges and to turn your situation into so much purpose. I think it's
Yes.
such motivation for so many of us. We really grateful that you were able to share so candidly with what you have. We do have a few questions that have come through just prior to the webinar. One specifically is, what do you, as a person living with spina bifida, feel are priority issues for somebody with your condition?
Well, for me, it is quite challenging with many things in in a person compared to to a person living with a disability to a person that has absolute no disability as a normal person. So for it can be quite challenging for us due to spina bifida is a neurological diverse the diagnosis which affects the brain and the spinal cord. So spina bifida is actually a it is a diagnosis where where it by missing vertebrates in the spinal cord. So which includes fluids on the brain, constant fluid which which has to be drained by a VP shunt. So for me, there are quite challenges that I have come across, but for me, I just see it as a different way of overcoming that challenge.
So you feel,
So for me,
no, sorry, carry on.
so for me, the like the different priorities of a spinal bifida is that we tend to do we tend to do things in a different way. So that actually that don't put us off from doing things as a normal person. So for me, I do things on my own, very independent. So for me, I go to school, I do things on my own. Like I said, to be a motivational speaker, it got nothing to do with being, no matter what, if you're in a wheelchair, if you like, if you're completely paralyzed or anything. Motivation comes in many ways, and especially if you're a person with living with disability. And for me, it's like it's a it is a way of of looking into ways of putting that specific thing into a different way of doing it.
Thanks, Alamuddin. You actually answered the second question that I was about to ask you. The second question was, what keeps you motivated? What leads to all the motivation that you have? But I think you've answered that adequately also. Thank you so much for being here. And please stay tuned for Dr. Tigeni. I think you'll be able to hear some valuable insights here as well. Thanks, Salamuddin.
Yes.
I'd now like to introduce our second speaker for this evening, who, for those who've joined a little bit late, her name is Dr. Samdawit Tigene. She's a medical doctor pursuing public health as a specialist, as a specialty with a focused interest in conducting clinical research, currently in Ethiopia. And she forms part of one of the CHAMPS projects, specifically the SOL project, currently being conducted in Ethiopia, where she serves as the research coordinator. Thank you, Dr. Tigene.
Thank you, Donna. Can you hear me?
Yes, I can hear you. Thanks.
Okay. I have a bit of a connection problem. So would it be okay if I turn my camera off for the presentation?
Yeah, sure.
Okay. So I will share my screen now. And thank you for the kind introduction. So I'll proceed.
Thank you.
Can you see my screen?
Yes, thank you. We can.
Okay. Thank you again, and hi everyone. And I'm very much excited to be here and to hear Salamuddin explaining what we have been experiencing in the clinical setups. So I will be presenting about neural tube defects in general, going through the spina bifida, problems in spina bifida and challenges, and then going to our practical experience and possible opportunities for improvement. So neural tube defects are a group of birth defects that arise from failure of neural tube to close properly during the early fetal development period. And this neural tube is supposed to form the brain and spinal cord of the fetus. And when there is a problem during the closure of this neural tube, then these defects occur. And they are the most common forms of birth defects, and they affect fetuses and newborns worldwide. And as you can see here, we have different types of neural tube defects, and these differ in severity. And as you can see here, we have spina bifida, which is open and closed, and we have encephalocele. These are the only two types of neural tube defects that are compatible with life. And we have encephalic craniorachis, which is the severe form affecting both the brain, the spinal cord, and we have anencephaly, where part of the brain has not formed. And so going to the spina bifida, which is the most common kind of neural tube defects, and this spina bifida is compatible with life, as I have said earlier. And there are different types of spina bifida. One is the closed type, which is usually present as a skin dimple, hairy patch, and so on. Usually, we don't have further complications with this kind of spina bifida. But we have another one, which is the open one. We're having an open defect, and this can be the child can present with bulging mass around the back. So when we see the causes of neural tube defects in general, so they occur because of the complex interaction between the genetic, nutritional, and environmental factors, and the commonest nutritional factor is folic acid, and maternal folate insufficiency before and during early pregnancy, that is within the first months of conception, is the most common preventable risk factor. And the management of spina bifida or children who are born with defects that are compatible with life will be depending on the severity of the condition and the presence of complications. However, the most common treatment is the surgical correction of the defect, and then we will treat the complications. So you have heard earlier Salamuddin saying that he has a shunt, which is a tube that will remove the excess fluid from the brain, and that's one of the commonest complications of spina bifida, which is hydrocephalus. So in addition to treating the surgical, in addition to treating the defect surgically, there is also the aftercare, which is very critical part of treatment. And the prevention is, as I have said earlier, so usually it comes from folate deficiency. So having preconception care to see whether there is a folate deficiency and correcting that, or if there is any genetic abnormality, and then supplementing folate and having a mandatory food fortification program in the country will help prevent those neurologic defects that are caused by folate deficiency. So coming to the challenges, I was rushing through the first part because that was more a clinical part, and now we come to the challenges. So I think Salamuddin has really explained what it means to have spina bifida and to see the challenges every day. So children who are born with spina bifida might have complications affecting the brain, like hydrocephalus, as I've said earlier, and that might affect their development. So they might have developmental delay, they might have learning disabilities, they might have seizures, and even sometimes fatal outcomes. And they might have orthopedic complications like spinal deformity or foot abnormalities like club foot. They usually have urinary tract infections and lack of bladder and bowel control. And people with spina bifida they often have nerve damages, so it will keep the bladder from emptying completely. So in the long run, it might lead to acute renal failure. And these challenges also lead to high medical care costs, lifelong disabilities, and mortality. And so this is very difficult for a person living with spina bifida. In addition to that, the parents will also be affected by it because they have to raise a child with spina bifida, and they also have to care for other children. And usually the community don't have awareness about such kind of birth defect, so they might think that it's a curse. So like in addition to the socioeconomic challenges, they also have the psychological stresses due to lack of awareness. So moving forward, these children also face challenges in achieving autonomy because most of the children we have in the hospital have paralysis, which means they cannot move their legs. So they usually depend on their parents for movement. And for the parents, we also teach them clean intermittent catheterization so that they can empty the bladder of the children. They have also problem, as I've said earlier, with bowel control, so they might need a lot of support from their families, and they might depend on their families for long. So when they are growing and they're moving and transitioning from time to time, I mean, when they're transitioning to adolescence, they might face challenges with this autonomy. And also problems will persist into adulthood, difficult regarding employment and starting family. So these are common challenges that these children face once they reach to adulthood. And survival rate into adulthood is associated with advances in medical treatment. So Donna was saying I'm from Ethiopia and I've been working here. So from my experience, we don't have children. I think the oldest child that I've seen is 16 years old, and I mean like in the hospital. Otherwise, I know a very dear friend who is a medical doctor and who is living with spina bifida. So otherwise, we don't have that much of children transitioning into adulthood because we lack advances in medical treatment. So going to the general challenges, so we have cultural myths and misconceptions, as I've said earlier, in the community. This kind of disease was not that much known. So people think that it was a curse, and they used to blame the mother, saying that it was a punishment from God to what they did. Or to what the family did. And there were clinical awareness gaps because once the child has surgery, families usually think that it's curative and they will not be able to bring the child back for continuous follow-up, considering that the child has been cured after the surgery, and geographical barriers because most of the family that comes to the hospital, they come from a very rural areas. So it's very difficult for them to bring the child, even for first visit, let alone to bring the child every week or twice a week for physiotherapy and so. And the socioeconomic status, low socioeconomic status is also very difficult. And the other one is structural exclusion. With this, what I mean is usually in the school, we don't have a place for the child when they grow up. There is no place for the wheelchair to go to the classroom. It's not inclusive. I mean, the structure of the education centers, even youth centers. So these things have been a challenge. So in my practical experience in the hospital, so usually care for such children is incomplete because, as I've said earlier, usually they bring the child to the hospital once and then they think that it's curative. Or for those who understand, it's very difficult to bring the child back to the hospital for a very frequent visit. And the outcome of surgery is poor. And children usually require close follow-up and support in addition to surgery. And that initially it was very difficult to do this because of different reasons that I have mentioned earlier. And as I've said repeatedly, the aftercare is the most essential part of treatment after the surgery, including Sorry, was it discontinued?
Yes, it was. There was a bit of a break in the sound there, Samrawat.
Okay.
Do you want to share your screen again, please?
Okay. At which slide did it break? Did we reach to the opportunities, the practical experience, or the challenge?
Challenges, I think, yeah.
Okay.
What is the next slide? Sorry?
It's the practical experience.
This is where you were, yeah.
Okay, so in the practical experience that I have in the hospital, which is the a tertiary referral hospital, care for children with spina bifida was incomplete and the outcome of surgery was poor because parents had difficulties to bring the children after the surgery because they usually think that the first surgery was because of different reasons like socioeconomic status, geographical barriers, and so. And as I've said earlier, the children will require close follow-up and support in addition to the surgery. That's the aftercare, which is the very essential part, which includes physical therapy, wheelchairs, and catheters. And in addition to the rehabilitation, we need behavioral intervention for these children. So what are the opportunities? So still we are not near to the optimal care that is required for these children, considering that they need the best quality of care that we can provide, but we still have the unique opportunity to have innovative ideas using available resources, considering that we are in the low and middle income countries where there is resource constraint. And we need to leverage community-based rehabilitation centers, considering there are geographic barriers, and we need to include families in the treatment because families are the ones who are going to see these children at home. And we need to bridge the gap between the specialized care and the daily reality in the households. And then we need to have we need to work on inclusive policy and structural change because those will be, once they transition to adulthood and adolescence and adulthood, those policies and structural changes will improve their quality of life in the community or in their real life scenarios. So our way forward, as I've said earlier, clinical foundations, we need to improve our quality of care in the hospitals. We need to combine specialized expertise, having a multidisciplinary team for this to treat these children, and including communities, because these children are going back to the community. So we need to have this networks to create the environments where these children can thrive. So our practical experience, in the hospital, the first thing we did was, as Donna was explaining earlier, I was working in the SALT project, which was a study that was established to see the burden of neurological defects, the population burden of neurological defects in the eastern part of Ethiopia, and the outcome of children, as well as the folate deficiency insufficiency level and the community perception of neurological defects. So the first thing that we did was to have a collaboration and partnership, because this is not something that can be done alone. So there was a collaboration between the hospital. There was Reach Another Foundation, which was an organization that's establishing center of excellences in the hospital, in different hospitals in Ethiopia. And then we have a local NGO that was working in the area of parental support. So we had collaboration and partnerships, and then we established a separate OPD for children who are coming for follow-up. So these children usually require different specialties to examine them. So considering that they are far away from the hospital, which is found in a relatively urban area, we try to have a multidisciplinary clinic where they can be seen in one place, and we have made the OPD very child friendly, so that when they come, they see a friendly faces and they can be comfortable. And we have made every services in the hospital free, so that we can alleviate some of the socioeconomical burden. We give regular health education so that we can create awareness in the hospital as well as in the community. And for those who cannot come to the hospital regularly, we have a regular phone follow-up. We call them or ask what's happening. And we have a dedicated phone for them where they can call and ask if they have any problem. We have a separate rehabilitation center where these children can be seen. And we have a support group for families so that they can support each other, because this journey is very difficult for families as well. And we really work on community engagement, because once the community was made aware, then like the
with you. Are there any other questions for Salamuddin? Fiona, you can unmute yourself. Thank you.
Hi, yes, thank you very much to both of you for your presentations. I took particular note of the fact that you said when a parent is asked to bring the child in for surgery, which is probably when the child is still very small, a baby, they think that that's going to cure the child, and so they don't come back. I'm just wondering if you, and that's very understandable for a parent who's going through the shock of receiving a child that they didn't expect and not knowing how fantastic that child's future can be. Has it been tried to actually explain to the family before they even come that it's not a one-off and that it's only the beginning of the journey? I'm just wondering if that has been tried in your setting in order to try and avoid future no-shows? Thanks.
Thank you, Fiona. So we did. So one of the things that was done was a center of excellence was established, and then we identified these challenges. So what we did was having regular health education sessions, having a phone follow-up, and having a one-on-one counseling sessions where we explain everything. And sometimes, because these parents are in shock, they might not understand. So we will call them back. And if they are in the catchment areas of the CHAMPS, we also have different community engagement activities, so they will be reached through that. And if they miss any of their appointments, because we have the regular phone follow-up, we ask them why they didn't come, and we try to help them financially if they have a problem in the transportation. And one of the things that they were complaining about was the cost of treatment. So we have made the hospital, so for any service in the hospital, we have made it free. So that is how we try to solve this problem. Have I answered your question, Fiona?
Yes, thank you very much.
Any further questions for either Salamuddin or Dr. Tigene?
There's one in the chat.
Salamuddin, this one's directed to you. How has your family impacted your journey living with spina bifida and hydrocephalus?
Well, for me, they were very quite supportive, very like God, I put it, like they're always there for me, no matter what, no matter obstacles that I go through or anything. And especially my third eldest brother, that is a member of ASBA, he's very quite very supportive, especially my mom that takes me to my hospital with all my hospital appointments and all of those things. Well, I'm very grateful to have them along my side, and yeah, well, for me, they are very supportive, very like very outspoken. Like if if I ask them for anything, they're there for me, and I hope that answers your question. Thank you.
Thanks, Salamuddin.
So I have a question to Salamuddin. Can you hear me?
Yes,
Yes,
we
I
can hear you.
can.
Okay. So my question is, first, I'm really happy to meet you, and when you were younger, your family were, I think, will take care of you for most of the parts, and then when you transition to adolescence, how do you explain those transitions? How difficult was it? So that's my question, because seeing you, it's an inspiration for the other children, for other families, and it's one of the techniques that we use in the parent support groups, because sometimes people think they're the only one going through such kind of periods, and it's going to be very difficult. But when they see people going through the same thing, it gives them some relief. It gives them hope. So how do you tell us about the transition to adolescence?
Well, I am still under Red Cross Hospital, so I haven't transitioned yet to adolescence due to my neurodevelopmental uh,
You've still got operations.
due to due to operations that still need to be done. So they they're still deciding to to see if they can transition me over to adolescence in the future. So as of now, I'm still under Red Cross Children's Hospital.
Okay, thank you.
Go ahead, Fiona.
Thank you. This is probably a question to everybody who's here. Is lots has been said about support groups, about peer support, about groups, family support in groups who have similar experiences. My experience often has been that social workers I've worked with have, for the most part, been very reluctant to get involved in support groups. They prefer working one-on-one. And I'm just wondering if anyone's got any magical words of ways that you have managed to facilitate or support or encourage or convince your social workers that group work is actually the smart way to go. It's not the only way, but if you want to reach more people and often be much more beneficial to your individual clients, exactly what someone mentioned is you realize you're not alone. There are other people in the world who are going through similar experiences, and it actually is encouraging to share experiences and to learn from each other. If anyone's got any bright ideas, I would love to hear them. Thanks.
Hello, if I may. Yeah.
Thanks, Abeda.
May I speak? Yes.
Yes, sure.
The spinal defects clinic at Red Cross, as well as the E26 clinic, the spinal bifida clinic at Groote Schuur, they have their designated social workers on duty. Yes, and they are very, very helpful. If one of my team who's dealing with, and they deal with the patients in the waiting rooms and afterwards and across the road at our center, and they are very helpful in specific situations with the patients. That we can take them there, refer them to that. They deal with social grants. This is one of the first things that my team sees, that the social worker assists with starting out the social grant. That's one of, but otherwise the social workers in the past, with my experience in the spinal defect clinic, we had I don't know if you all know she's now Dr. Carla Brown, at the head of social work at Red Cross, was one of my team members and still is today. We were at the Nurses' Day together yesterday. And yeah, they are helpful out there. There's also there's also a body out there called District. Oh, I can't. It's like they out there in every single area, right up the garden route. They are social workers. I think it's government government supported, and even they, I have my problems sorted out in George, in where Stellenbosch, wherever. They are specified out there, and they are very helpful. They go right to the door. But we also, the association also call people up, contact them, come to our center for solving the problems. So we serve in that way as a social worker as well. As I said, yeah, I've got so much I don't want to keep hogging the phone, but that is what So yeah, I mean, I invite you all to contact us and for any assistance, in any which way, because we are lucky in that way, because we are connected with Red Cross and we are connected with Grootes Care. So we take the mother and the child. In fact, I take the mother and the child before the child is born. They are referred to us when the mother is still pregnant, and we take the mother from that moment through the birth, right through the child's life. We are assist them. We walk the journey through them. In fact, I've started a new project now to give them a journal so they can journal their lives with their child, which is, it's just very new. So with this, that's going to show in years to come as a research project, probably, of this journal. But we see the child, the mother, when she's still pregnant, and we walk the whole journey through with them now, right up to adulthood. Yeah.
Thanks so much, Sabrina. And love the idea of the journaling, such a powerful tool just to record all those, all that qualitative data. I've got one more question for Salamuddin, just looking at the time. Salamuddin, this one is for you. It was posted in the chat. What is your advice for children who will grow up with spina bifida?
Well, the advice that I would actually give to children with spina bifida is always try to be independent, and always try to go against all odds, and especially try to overcome obstacles that you might think that you are able to, because in the future it is going to make you stronger, and there are going to be obstacles, challenges in life that is going to make you feel it is going to bring you down, or like as going to feel like you are not you're not doing enough. But like if you have a proper, like a positive mindset in life, is to is to overcome those things. So for me, I always look at it and always focus on one thing, step by step at a time. And the type of knowledge and the knowledge is to always have, is to seek out questions about your disability, and always know that there is going to be somebody that is going to answer your question, especially doctors, uh, or any healthcare worker that specify at using that specific field, like spina bifida, which is like neurological problem, neurological neuroclinic. So that that is a place for asking questions and being open-minded about the disability. And yeah, that's all I would like to say. Thank you.
Thanks so much, Salamuddin. And thank you to everybody for joining us today. Especially thank you to our speakers, Dr. Degene and Salamuddin and his family. And if there are no further questions, I'd just like to end off this evening by just reminding or just notifying you all of an online mini training workshop which will be taking place in July, the 15th and 16th of July. That's focused on postural management with some excellent and experienced, really knowledgeable speakers. It's a Wednesday and Thursday, and takes place between 10 and 2:30 on the Wednesday, 10 and then between 10 and 3 o'clock on the Thursday. And please just keep an eye out on our Facebook page, LinkedIn, or the website, just to have an idea of our upcoming conference in August and then webinars which happen on a monthly basis. Thanks everybody for joining this evening.
Thanks. Bye.
Bye.
Thank you.
Thank you, Ms.
Good,
Donna.
good night, everyone. Well done, Salamuddin.
Yes.
I'm proud of you. You spoke very well, my darling.
I know.
That's about it.
Thank you. Bye.
Bye, everyone. Good night. Assalamu alaikum.
Alaikum salam.